Jalore is a district which has been historically lagging behind in most indices related to women, be it sex ratio, be it female literacy, be it nutrition. In all criteria, this district has been lacking for a long time. So when we tried to understand the causes behind this particular gender-based inequality, we realized a major cause was menstruation, both in terms of understanding what it is and menstrual health management, which acted as an impediment for women to coming forward, which was a cause for various health issues and women withdrawing from the public space. So we started on pilot basis to have workshops in villages and gram panchayats and schools where there were adolescent girls, and we realized that people are simply unaware what this life process is. So when we started talking to them, even women like 60-year-old, they did not know what exactly menstruation is and what are the means to manage it. So after discussion with all the stakeholders and interaction with local women, we started a standard format for our workshops where we prepared presentations with flexes wherein vernacular language was used to explain women what exactly this process is. We also took 3D models of body parts and the reproductive system and the urinary system to explain how the human body works. Along with it, we gave them some literature which was sort of interesting to read, like a comics on menstrual health called Menstrupedia. And we also distributed samples of sanitary napkins, menstrual cups and tampons. The idea was to make these women aware that there are so many means for menstrual health management and they can make an informed choice. And it was during one of such sessions when we distributed these menstrual cups, we saw women who were asking us questions like, if we use these, how are we going to use the washroom? It just shows what is the level of ignorance, that we do not realize that these are two separate systems of the body. The reproductive system and the urinary system. So therefore we made these workshops extensive, where we engage rural women, even urban women, working women, adolescent girls and college going girls, so that we can make them aware about what menstruation is and what are the various means for menstrual health management and nutrition. Along with it, during these workshops we realized one impediment which women always feel was mobility, inability to go around by themselves. So we thought of teaching them scooty riding, and we also realized that there are a lot of girls who have been given scooties under various government schemes. Meritorious girls are given scooties, but most of them were not using it because they don't know it and nobody teaches them. So we started this campaign for scooty riding so that women have the sense of empowerment. They can move around by themselves and they can make use of the scooties that government has been distributing to girls for a long time. Along with this, when we interacted girls about moving out in public space, we also realized there was a concern for safety and self-defense. So we started this entire center for self-defense, and in a process where we were teaching the girls self-defense, we discovered that in our district we have a lot of girls who are quite well trained in mixed martial arts and wushu, but they couldn't pursue it further because of lack of facilities and a dedicated center for girls. So along with the self-defense center, we also started wushu, wherein we have proper equipment, ring and a coach, and we try to initiate girls into sports, and we have girls as young as 3 to 4 years to there is no upper limit, and all are welcome, and we teach them sports as well as self-defense. And in past 4-5 months, more than 30 girls have won medals at various stages.